The yearly checkup for the Commander-in-Chief. President Trump is getting set to leave Walter Reed Medical Center, where he had his annual physical this afternoon. We're joined by a cardiologist and author of Women and Cardiovascular Disease. Dr. Kevin Campbell is with us. You know, it's interesting, Doctor. We don't know specifically how the president's examination today went. We haven't received any statement about it. But I was thinking back to last year, and of course, there was a lot of attention given to the news conference and everything else. But what came out of that, as I remember it, is that, and I remember the way the news articles were written, is that the president, like many men his age, and he's in his 70s, has what was described as a common form of heart disease. And I was thinking, so many people, right, have some form of heart disease.
So our president has risk factors for heart disease in that he has high cholesterol. His total cholesterol last year was about 220, and his bad cholesterol, his LDL, was about 140. So he does have risk for that. He also had a CT scan that did show some calcium in his heart artery. So we don't know for sure that he has heart disease, but he certainly has risk for it.
The risk
and
that would
evidence
associate. Okay, so that's the way to, and as we're seeing on the screen now, 121 million or more than that Americans have some form of heart disease, right? So when you have people, say in the president's case, who have risks for it and are, say, in their 70s, that's a manageable condition, obviously, but serious nonetheless. What advice do you usually give them?
You know, so heart disease is the #1 killer of both men and women in the U.S. today. In fact, more women than men die. So I think what you have to do is manage your risk factors. Understand that the risk factors for heart disease are high blood pressure, high cholesterol, family history, smoking, diabetes. These are things that can really put you at risk. So you need to understand if you have those risks and then work with your doctor to modify those risks.
On the women, I know you wrote a book about this, Women and Cardiovascular Disease. You point out that is a misconception a lot of people have, that it's actually more prevalent among women than men. Are the symptoms different? Does it manifest itself differently?
You know, interestingly, symptoms of a heart attack are going to be chest pain, shortness of breath. Women can have atypical, vague symptoms, feelings of dread, unwell feeling like flu-like symptoms. They may have pain in their back. They may have nausea. So it can be very atypical. And it's important, if you're a woman and you have risk factors, you need to find a doctor to make sure that they assess those risk factors and see just how much at risk for cardiac disease you are.
Yes, you wouldn't know it. A lot of people wouldn't think that it had anything to do with heart disease, and maybe that's why that goes undetected, unfortunately, too many times. All right, Dr. Campbell, good to see you today. Thank you. Important subject. Thanks for coming on. We appreciate it.
Especially on a day when the number of trips to the fast food restaurant crosses over the number of trips to the gym. The gym decline, fast food, and then we also tie in the heart health. It'll really get you off on the right foot for the weekend.
We're trying, because that's tomorrow, right? That's the day. Who knew? If you're making your New Year's resolution.